Let me ask you a follow-up question about that. I think a lot of us have gone through our careers and coped by compartmentalizing. So we have this work personality or persona, and we have a home persona. And I think at stressful times like this, everything starts to blend together, and there are intrusive thoughts and there are intrusive topics. And you're also constantly worried about how your personal life is going to be affected by this medical catastrophe. So do you have any thoughts? Do you have any suggestions about that?
I do, and let me think about it talk about it in a couple of different ways.
Great.
And I think, it varies by discipline, and in part depends on where you are in your career trajectory. But for those of you that did fellowships or internships or residencies, that's a pretty intense time, right? There's a lot of stress that's there. And even though there's a separation of personal and professional, I think for a lot of us, our best friends lifelong are the ones we went to med school with, or the ones we went to grad school with, or nursing school with. I mean, that's our group, right? That becomes our inner circle. They're professional, but the professional becomes personal. So you're right, there is this blurring, this kind of immersion that happens when there are shared powerful experiences that we go through. And even though there's a negative side of that, it's a stressful experience, there's also a really incredible, sort of wonderful side to it, where we know that standing side by side us, either figuratively or literally or figuratively, that's our tribe, those are our peers, that's our friendship network as well as our professional network. So I think it's hard to pull them apart. You did mention, though, the sort of intrusive thoughts and worries, and I wanted to reference a couple of recent studies that were done, specifically COVID-related and related to the anxieties, worries, and needs that were articulated by frontline healthcare workers. And again, this was a multidisciplinary group. One was done locally at UCSF by Weston Fisher, a psychiatrist, and Kiran Gupta, who's a hospitalist there. The other was done at Stanford by Tate Satterfield, who is the chief wellness officer at Stanford. Both used a qualitative approach to interview these frontline providers and get a sense of what are their worries, and then once they have an idea of what they're worried about, going to their sort of healthcare organizations and saying, okay, this is what your people need, can you give it to them or not? But I just want to share sort of what those needs were, and maybe we can think, a little bit together about how we can get the support that will make us feel more capable of facing, what might be ahead. So for both of those groups, and their results were remarkably similar. Some of the biggest fears, and I think on the most concrete level, was having adequate protective equipment. So knowing that they could protect themselves from exposures, and of course related to that is if they're protected, then they're not bringing the virus home to their family or to their friends. They are worried about danger to self, they're worried about danger to others, and we certainly hear that there's a number of cases of healthcare workers that have contracted COVID as a consequence of contact at work. So that was sort of worry number one. Worry number two, and related to that, was the lack of connection, the distancing and the isolation that PPE sometimes engenders. If you can't see a person's face, or you're sort of wrapped yourself in this bubble, it's difficult to connect with your peers, it's difficult to connect with your patients. So many of our frontline providers, they've blown up their name tag picture, and they actually affix it to the outside of their gown so that people can see and patients can see that there's a face there, even if their face might be covered with a mask at the time. The other sort of bigger picture is I think, in social distancing, which is physical distancing, because we really need social connection, social closeness. But it's hard for people to remember and to easily access their social support. So that was one of the concerns that providers had as well, is, usually I can reach out to my friends or go over to a friend's house for support, but I can't do that now. So what am I supposed to do instead? Zoom, we love you, but it's not the same, as a face-to-face contact. Some of the other concerns were lack of resources and things like lack of rapid testing. So just not knowing, was I exposed, was I not exposed? Do I have antibodies? Have I had this already or not? And that ambiguity, I think, contributes to the stress that people feel. Another source of stress for providers was uncertainty of whether or not their employer would support them if they became ill. So what happens if I'm sick? Where does my job go? What's happening now in terms of my RVUs, my work productivity? Am I going to be excused for that? Our childcare center closed. How am I supposed to get childcare? Is there going to be provisions that are made by my employer for childcare? Will they help my family if my family needs help and I become hospitalized? Some of the other concerns, and we've heard more about this, is a concept called moral injury or moral distress. And this is when an individual is put in a place where there's limited resources and they have to make rationing decisions. So I have multiple patients that need a ventilator. Who gets it if I only have one or I only have two? And am I going to be personally responsible for that decision? We hope the answer is no. That's why we have complex, well-trained ethics committee that have hopefully community representation, and that those protocols should be put out in advance, but still an understandable worry that a lot of healthcare workers have. Some of the other obvious worries is just the concerns about being overworked, being overtired, making mistakes when you're overtired. There have been a number of, I know in the sort of epicenter of the pandemic in New York City, there's a number of non-hospitalists that have been deputized to become hospitalists. So there's ophthalmologists, there's pediatricians and others that have been pulled into the hospital. And so they obviously are having some concerns and some worries about the skill set that they might bring to the table and whether or not they will make a mistake. So those are some of the common worries, and those are big. And what I really liked about the piece that Schoenfeld published just a couple days ago in JAMA is there was this very sort of pithy, simple ask to the healthcare organization. And he described it in sort of 5 simple statements. It was hear me, protect me, prepare me, support me, and care for me. So hear me, protect me, prepare me, support me, and care for me. And you can imagine what most of those are about. Listen to what your frontline providers have to say, because we're the ones on the front line. Protect me from infection by providing PPE and workflows so that I'm not overtired and will make mistakes. Prepare us. If you're pulling someone that's not used to hospital medicine or isn't an intensivist, give them the training and the support that they need. Support me, support my family, financially, medically, in terms of childcare and other services, and care for me. So if I get sick, are you going to be there for me? Will you take care of me if I become depressed or I become anxious? So hear me, protect me, prepare me, support me, and care for me.